cardiovascular disease remains the world's leading cause of death. Yet, early warning signs are often hidden, especially in patients with obesity. Standard EKG interpretation depends on consistent electrode placement and accurate amplitude measurement. But body composition, particularly obesity, distorts signal amplitudes. MRI can detect structural changes, yet it is too costly and impractical for population-level screening. More than 30 years ago, vascular surgeon and researcher Heikki Riekkinen began asking a simple question. Why didn't EKG signal strength always match what was happening inside the heart? During his early research, he noticed something unusual. Changes in blood volume and heart strain were happening, but the EKG signal size did not consistently reflect those changes. At first glance, it looked like random variation, but it wasn't random. The heart was speaking clearly. The measurement system was not. Dr. Riekkinen discovered that differences in electrode placement and body composition, particularly obesity, were distorting EKG amplitude measurements. In one study, even small, symptom-free reductions in blood volume produced measurable T-wave changes when measurements were performed correctly and consistently. That insight led to a patented breakthrough. Dr. Riekkinen developed a method to standardize chest electrode placement based on human skeletal dimensions. More precisely, the relationship between height and sternal length. The method also corrects amplitude distortion associated with body composition. The result? EKG amplitude becomes standardized, reproducible, comparable across body types and over time. What was once considered noise becomes meaningful physiological intelligence. For decades, EKG amplitude variability was treated as noise, a technical imperfection to overlook. Biopotential changes that assumption. By standardizing electrode placement and correcting obesity-related distortion, amplitude becomes quantitative intelligence. What was once unreliable becomes measurable. What was once discarded becomes clinically meaningful. This enables true longitudinal cardiovascular monitoring, not just a single snapshot in time, but dynamic tracking of physiological change. What if we could measure cardiovascular aging early enough to influence its trajectory? It may also open the possibility of tracking aspects of cardiovascular biological aging itself. Because when subtle cardiovascular changes become measurable earlier and more consistently, individuals and clinicians may gain new insight into how lifestyle, treatment, and risk factor reduction influence the functional aging of the cardiovascular system over time. For some individuals, targeted lifestyle intervention may help slow, stabilize, or potentially improve aspects of cardiovascular aging dynamics before advanced disease develops. Small amplitude shifts, previously invisible, may now signal early intervention, including early vascular changes associated with hypertension. When these changes are detected early, before irreversible damage occurs, targeted treatment and lifestyle intervention may allow cardiovascular remodeling to stabilize or even regress. In other words, hypertension may no longer be something we only manage, but something we monitor dynamically, intervene on earlier, and potentially reverse in its early stages. Earlier detection means earlier intervention. Earlier intervention means fewer acute events, and fewer acute events mean lower long-term care costs. The technology also enables detection of silent blood loss in post-operatively and emergency settings, offering critical insight during early triage. From preventive cardiology to acute care, previously hidden physiological signals become measurable. Beyond diagnostics, Biopotential creates a new layer of standardized cardiovascular signal intelligence, with the potential to reshape how cardiovascular disease is detected, monitored, and managed at scale. Cardiovascular disease, including heart attacks, heart failure, stroke, and vascular dementia, remains one of the greatest economic burdens on healthcare systems. In the United States alone, it costs hundreds of billions of dollars every year in healthcare expenditure, lost productivity, and long-term care. Early detection changes that. When subtle cardiovascular changes are identified before symptoms appear, treatments become more effective, less invasive, and significantly less costly. This enables better patient stratification, improved therapy monitoring, and more precise clinical decision-making across large populations. For pharmaceutical development, standardized cardiovascular signal intelligence enables a new layer of real-world physiological data, improving patient selection, trial sensitivity, and therapeutic monitoring. This has the potential to accelerate development timelines while reducing the cost of bringing new therapies to market. With demographic shifts and rising risk factors, the economic burden is expected to increase dramatically over the coming decades. This early signal intelligence accelerates clinical development and lowers the cost of bringing new therapies to market. This is not a new test. It is a new reason to use a test we already perform millions of times every day, with dramatically better outcomes and cost efficiency. The innovation is remarkably practical. A positioning device is aligned along the sternum using anatomical landmarks that can be identified consistently, even in obese individuals. Based on the relationship between body height and sternal anatomy, the system standardizes chest electrode positioning objectively and reproducibly, eliminating variability between operators and clinical settings. Electrode placement is guided directly by the device itself, without requiring traditional intercostal space palpation. The result is a more consistent cardiovascular signal, creating reliable amplitude measurements that can be compared across time, patients, and care environments. In other words, the innovation standardizes how the cardiovascular signal is captured, so the physiology can finally be measured consistently. Think about this not just as technology, but as impact. Because when we detect risk earlier, when we intervene sooner, that means more time, when it matters most. This technology isn't just about signals on a screen. It's about the heartbeat of everyday life. Your family, my family, and every family who deserve better care, earlier insight, and more peace of mind. Because the cost we care about most isn't on a balance sheet. It's the cost on families, on futures, on the time we get to share together. After 30 years of research, Biopotential helps shift cardiovascular care from late crisis to early care. And that shift saves not just dollars, but days, years, and lives. For decades, early cardiovascular changes were hidden in plain sight. Now, the signal is measurable. Now, it is standardized. Now, it is actionable, and potentially influence the trajectory of cardiovascular aging itself.